Over at Community Regional Medical Center, a severely injured patient is being airlifted to the hospital. The young man crashed while skiing and is in serious condition.
We know that he has head trauma. We have to suspect that he has neck trauma that often goes with head trauma, and we don't have high suspicion of other injuries at this time. I don't know if he had loss of consciousness. I think he did. I know that afterwards he's showing signs of a concussion. He's repetitive. That means he asks the same questions over and over again, and he's has altered mental status, all of which we believe is from the trauma.
Depending on if he has tenderness or diminished sounds or anything that looks abnormal.
The trauma team is ready to go. Nothing is left to chance. A high-speed elevator will take the injured skier directly to the trauma room. Back at Community Regional Medical Center, an injured skier is being brought into the trauma department. He fell while skiing and hit his head hard.
Went down on his face, slid down for an unverified distance. Probable LOC, Glasgow 14, doesn't remember the event, and he has a hard time remembering things that we tell him. He was able to tell me he lives in this, that was 2009 still. Vital signs have been good. Heart rate's been about 80 to 100, a little bit variable. Respirations are good. Lungs are clear bilaterally. He doesn't complain of anything other than his facial abrasions here and midline thoracic back pain upon palpation, but he has no neurodeficits otherwise.
Midline thoracic.
Yeah, midline thoracic.
You know where you are right now?
I'm still in the hospital, so.
Yeah, good. What happened today?
I'm guessing I fell.
What's that?
I'm guessing I fell.
I'm guessing you fell. You have any trouble breathing right now at all?
No,
No, okay. Do you have any allergies to medications?
not that I know.
No. How about any medical problems?
Not that I know.
Deep breath in for me. Okay. One more time, deep breath in. Good. Does it hurt to take a deep breath? No. Okay. All right. You know what year it is right now?
Oh no.
09? What month is it? What month is it? Take a guess. There was just a holiday that passed.
November.
November. Okay. It's actually January 2010. Okay. I'm gonna ask you that in a little bit. If you remember that, just let me know. All right. Does your belly hurt?
No.
No. Okay. Can we call for chest X-ray as well, please? Go ahead and lift your left leg up for me if you can. All right. How about your right leg? Can you lift your right leg up? Okay. Push down on my hands. Push down. Okay. Pull up with your toes. All right.
At Community Regional Medical Center, the trauma team is working on an injured skier. He hit his head and is showing signs of a severe concussion.
He's disoriented to time. His belly soft, non-tender. He's neurologically intact. Does your neck hurt when I press here at all?
Yeah.
It does? That's tender when I press? Don't shake your head, just say yes or no, okay? That hurts?
Yeah.
Okay.
The X-ray team arrives to take some much-needed images.
Do you remember what the date was that I told you?
No.
You don't remember? Okay. He had a head injury. It's a closed head injury, but he has abrasions on his face. So we're concerned about his neurological status. Obviously, he's confused. He doesn't know the correct date and time, even after you tell him and then ask him again. He's still confused. So I think at the least, he probably has a concussion, and at the most, we're concerned about some sort of bleed or injury inside of his head. So what we're gonna do is get a CT scan of his head, and we'll also get a CT scan of his C-spine to make sure he doesn't have any injuries in his neck.
The MRI scans are complete.
It doesn't look too bad to me. I mean, he's got a little bit of tenderness in his abdomen, so we wanna make sure he doesn't have anything bad going on in there. But his head CT so far looks normal. His C-spine CT scans look normal, so it doesn't look like he fractured or broke any of his bones. It doesn't look like he has an intracranial bleed. And he most likely suffered a concussion, and that explains his amnesia. It explains why he's so repetitive and asks the same questions. Generally, we road test him afterwards, get him up, have him walk around. If he can tolerate maybe a little bit of food without vomiting or getting nauseous, then he's probably stable enough to go home, especially if he has good family support.